take a logs in, Vidya. You can say something about your marvelous medicine.
Actually, just spoke to sir and he told he's logging through the iPad.
Okay.
Yes.
Right, great. So, good evening, everyone. Today we are 3 minutes late. Happy New Year and welcome to the first episode of Marvelous Medicine of 2021. And thank you for all the support. We've, like I said, we've already done 10 episodes back to back last year. So our endeavor has been to get, have an eclectic mixture of topics. Me being an anesthetist, I thought, okay, I won't be able to bring you pure surgical stuff or technical surgical things. I thought I will focus on the non-surgical aspects of medicine, but which is relevant to all of us, irrespective of which specialty we practice. So that is how this was envisaged. And today we thought we'll do something different because it's a new year, and we tried to reach out to uh, hepatobiliary and liver transplant surgeons and others involved in liver transplant, like hepatologists and anesthetists and intensivists. It's not going to be about heavy duty liver transplant discussion, but it is going to be more about the journey, like what actually makes a liver transplant surgeon. Why do people get attracted to the specialty, and how do they train, and how do they sustain in such a demanding and rewarding as well. Demanding and rewarding field. So Dr. AK had kindly consented to sort of talk to all of you, and so that you can take us through your journey. We'll just so if you don't mind, till Dr. Ananthakrishnan, his audio gets sorted, I would like each one of you to introduce yourself, so that we know which aspect to address, because we may not know each other in person. So I'll start with myself. I'm Vidya. I belong to the 1980 batch of JIPMA. I'm an anesthetist and I practice non-cardiac anesthesia at Fortis Mallar in Chennai. Of course, Patta Radhakrishna, all of you may be knowing, but Patta, take on so that next Kalayarasan can.
You skip me, Vidya. That's very unfair.
No, that's what I'm saying. You go next, I said.
Okay. I am Patta Krishna, and I am a classmate of Vidya. Actually, I belong to the senior by 7980. The whole idea of this transplant is, actually, transplant came into being when I was training, and towards the end of my training, it's like I was with Dr. Nandi when transplants were starting there. But strangely, and of course, transplant has become so very common in India, and some of the best results come from India now. But the every now and then we have post MCH people coming and asking that should I take up transplant, or should I take FHBB, or should I take up laparoscopic surgery and so on. That there's many of them are in a dilemma, and then because for once it was felt that we are saturated. India is a bit saturated with transplant surgeons, because when I was talking to Dr. Rila the other day, he feels that there are very few centers who do very large numbers, but there are very many centers who do small numbers. And for survival of the small number centers is not very easy. Surgeons sometimes may get frustrated, and they might have to take up HBB in addition, or they may move from transplant to HBB. And there are some other surgeons who may have to do some general surgical work when they're not doing transplant and so on. I think this COVID has changed the transplant scene so very badly that we have to rethink about how this is going to restart, and how youngsters should take up this particular specialty. So we thought we have a very rich resource of transplant and HBB surgeons, from senior to juniors from JIPMER, and possibly they'll throw some new light, and they may inspire some, or they may also talk about how difficult it was. So over to Nim. Nim, you have to unmute. Yes.
Yeah, I'm Virendra Kumar Nim, again 1980 batch from JIPMAR, and at present I am Professor Anatomy in PIMS Pondicherry. And the only thing The liver transplant I undergone the liver transplant 2.5 years back. Thank you. Next,
Biju?
next you can put somebody.
Alarasan, would you like to go next?
Yeah, sure, ma'am. So I'm Dr. Kalayarasan. I belong to a batch of 98 JIPMER, and I did my MS also from JIPMER. I was a student of Professor Ananthakrishnan and Professor Vikram. So currently I'm working as an associate professor in the Department of Surgical Gastroenterology, JIPMER. So, I mean, with respect to transplant, so that's since I'm working in an institute, not a exclusive transplant surgeon. So I'm part of the liver transplant team, which is headed by Professor Biju.
Dr. Ananthakrishnan is logged in. Sir, would you unmute yourself and start the proceeding, sir?
Good evening, everyone, and so nice to see all of you. And I hope I can see you continuously at some point of time. And it really brings back very strong emotions. You know, Vidya called me today AK-47 in Facebook, but I have now become AK-47, whose brain has become soft. So the barrel has been silenced, but the emotions have become different. So when I see all of you and see what you have become now, it's really a matter of great pride to me. And I'm reminded, you know, strangely, some 4 or 5 years ago, there was a CME of all old Jipmarites. Kalai was there, I remember, Sendil was there, Partha was there, and so many other people. And then they talked such high-flown things which I had never heard of. And when they finished, it suddenly occurred to me, and for the first time, I was really emotional. And I said, and I think I put it on Facebook, some of you might have read it. What a in teaching and gardening, we sow seeds all around us, and some of them fall on fertile soil and then quickly grow and become tall trees and become self-sustaining. And some of them seem to fall on apparently stony ground. But you can't give up. You have to go remove the crust and allow them to reach the fertile soil, water them some more, and perhaps fertilize them some more. And some years later, you can't make any difference out. And I was really moved, and I put it rather emotionally on Facebook. What a forest of redwood trees we have created in Jipmer all over the world, so tall, so luxuriant, and so rich in foliage. And that's exactly how I feel today. And it's extraordinarily strong emotion, and I want to listen to your experiences. I'm very, very glad that somewhere along your passage, we in Jipmer gave you a stop for a few years. Not that we contributed much to your development in the current field that you are, but we like to feel happy that at least for those years we were in contact, and we can take pride in your achievements today. And every one of you can accuse me of being your teacher, except perhaps Biju, and but he can accuse me of being his examiner in gastroenterology. Srinath was the most unfortunate one because he worked in my unit as an intern. He worked in my unit as a postgraduate. He had the misfortune of doing his dissertation with me. And just when he thought he had seen the last of me and ran away to Delhi, suddenly encountered me as his MCH examiner, and he was shocked beyond words. So nice to see you all, and very, very happy to see you. And the purpose of this meeting, I have a few more stories to tell. Being old and senile, sometimes these stories come out. That the idea is that you talk about yourself, particularly from the point of view, because yours is a very, very active, very difficult, and very glamorous field, wrongly called glamorous, and it attracts a lot of young people to that field. And I want this meeting to be of use to them. And I've drawn some questions. You may or may not like to answer all of them, but I thought those are relevant, and whatever you want to take, you can take. The first question is, what focused your attention on liver transplant, which is such a very limited and difficult field, especially when you all started, when there are so many more lucrative and lighter branches? And why did you deliberately take on this struggle? And secondly, having fixed your goal, which all of you did, how did you work towards achieving what you have achieved today? And who guided you in this path so that you can offer that guidance to the youngsters? I'd like to know, and others also, that what difficulties you faced on this journey and how you could sustain your motivation when I'm sure there were so many demotivating factors. I'd like to hear what advice you have for youngsters wanting to pursue transplant and hepatobiliary surgery as a lifelong career. And more than that, some of you, after spending so many years of training, some of them in my unit, Govardhan, for instance, Sushrut, they suddenly left the field. So I'd like to know why some people leave the field after putting in so much. Is it so difficult a life that you can't sustain, or it's for other reasons? Or is it because you can't find a stable employment after training, which gives you satisfaction and any other thing? And if you want to abuse me, you're free to do so. And any one of you can start, and I leave it to Vidya. Vidya is, is a terror, and all anesthesiologists are terrors because you see only their masked face above the curtain, looking very critically at what you're doing. And suddenly they become very active behind the screen, and you feel that you're killing the patient, and they are very, very worried. So Vidya leaves that impression on me. So I don't open my mouth much before her. So anyone willing to start can start.
I will request Sonal to start.
Yeah.
I'm just being partial because he's the reason I could get everyone together, because
Okay.
most of the contacts he sort of showed me the way how to get in touch with everyone. So Sonal, would you like to
Yeah.
start?
Yeah. Please,
I'm a
Sonal.
little,
Anytime.
yeah, I'm a little worried now that you shared that information, because a lot of people are going to come after me for that. So yeah, no, I think thanks very much for this really unique opportunity. It's an opportunity for all of us also to travel down memory lane for a bit and reflect on what has been, and what can be, hopefully, for generations to come, and for people who were thinking of walking down this path. I mean, firstly, as we all know, we are all here because of the common bond that we share in JIPMA. And I think although Sir chose to minimize that, but I think that that's a very strong reason why we are in the field that we are. From JIPMER, we were blessed to be taught by extremely committed, extremely dedicated, and skilled teachers. And I mean, it's just obviously values is a very trite and cliched term, but it actually is all about that, because we learned a very clear difference between right and wrong. We learned about ethics. We learned about commitment to the patient above all else. And especially from Sir's point of view, working with Dr. Ananthakrishnan as during residency as well as senior residency, it was about also knowing that it's not about operating, or you're not a technician. It's just about the thinking behind the operation. And those are the things that really guided career in liver transplant as well. Because after finishing my residency and working for a year in Prof unit, I went on to do surgical oncology at the All India Institute and moved then to the UK with a plan to do hepatobiliary oncology. And that was when I first worked in an integrated liver unit. And I thought that this was interesting because it challenged you at many different levels. Not only did you have an opportunity to think about the complex surgery that you would do. Obviously, the surgery itself is extremely complex and challenging. But then there was a lot of medicine and critical care involved in your patients as well. So there are several parts of you that are engaged and challenged in managing something as complex as a liver. And of course, we were also fortunate to be doing our training at a time when the specialty was evolving and perhaps had not matured. So, we were part of the growing pains of the specialty, not so much in the UK or in Canada, but especially when I came back to India about 9 years ago from after finishing my stint in the UK and Canada. And that was to set up a unit in India. And very naively, we believed that whatever we learned would be directly applicable in India. And, there were these, sort of pitfalls that in that understanding, adopting our practice to Indian requirements and understanding the challenges that India poses so uniquely. And I mean, as Biju knows, one of the challenges was developing an academic program to train transplant surgeons here. So transplant firstly is motivating. Obviously, what we learned in JIPMER guided us to this, at least it guided me to this particular destination. Secondly, it engages you at many levels, at not just our surgical complexity, but also medicine and critical care and so on and so forth. Thirdly, there is immense reward in having done something that is challenging and difficult and can be delivered as a team. Why people burn out? That's quite common. So I mean, transplant has a 50% rate of burnout. Most people who I have trained with, about half of them are not doing transplant anymore today because of the intensity that it requires of you in terms of engagement and commitment. So big teams, trusted teams working across things, knowing your limitations is very, very important if one has to pace themselves into a long career in transplantation. For people who are volunteering to do transplant, it's excellent for the reasons that I just mentioned, because it is definitely challenging and it will keep you motivated and engaged, well beyond, the first few years, because it is a rapidly evolving and exciting field. It is a lot of hard work. It will take a lot of commitment and sacrifices. So go into it with your eyes open, if you would, because there are definitely easier ways of making money.
Did you find difficult to find a place where you can get good training, Sonal?
Yes, I did, sir, because initially I trained in Leeds at St. James's Hospital, where the basics of transplantation were clear. But going forward, I did attempt to come back to India even at the time after I finished my time in the UK. But I felt myself unprepared, at the time, because it wasn't nearly enough to be able to stitch a liver in, for example. There was a lot of judgment where I felt that gap was lacking. So the time that I did in fellowship in Canada was very helpful from that point of view. And today, perhaps people who are taking up transplantation don't need to travel that far, because there are excellent high volume centers in India that are offering the same breadth of experience. So it's significantly different.
Would you encourage youngsters to take up the specialty?
Absolutely, because it's mostly because it's not just about the problems that are solved or about learning how to do, better anastomosis, for example. It's about the problems that are specific to India. Now, if we are offering something that is 20 lakhs, which most people can't afford, then there isn't much use of us being here. So I think that one of the key things that we've done differently is start up an affordable liver transplant unit for a program for children, where we do transplant for children for 2.5 lakhs, which is supported by CSR, for example, and crowdfunding. So I think that being engaged at different levels, I just didn't mean medically. It also meant administratively and also fundraising or making sure that people can afford the services that we offer. So today, I think that the bigger engagement would be in terms of healthcare access and healthcare equity, along with the technical skills as well, because that's also our responsibility.
Thanks, Sonal.
I
Of
would
course,
I would like Ravi Mardanagam to go next, simply because I just reached out to him this morning, and he, the others, I gave them enough notice and badgered them with messages and emails and all that. But to Ravi, it was just one message, and he sportingly immediately agreed and he's joined. So Ravi, would you like to go next? Ravi Mardanagam.
Yeah, sure. Thanks, Vidya. I'm from 1990 batch, for those of you who don't know me, but it's very kind of you to organize this. Actually, it's so nice to see so many of you, and some of them I'm seeing after like 20 odd years. So it's nice to see every one of you. So I graduated in 95 MBBS, and I did my MS in Unit 1 with Ananthakrishnan sir and with Dr. Kate sir as well. Finished in 99, and then did my senior residency as well there for 3 years in the same unit. And then I came over to UK the following year. Before we go on further, I really admire the way the JIPMER staff work actually in general, because after coming here, I realized like weekend ward rounds. So it's people could have easily stayed at home, and there are plenty of opportunities not to have learned from the senior experienced staff. Like every day afternoon we used to have teaching, and the weekend ward rounds, even on Sundays, I've seen both the senior consultants coming and doing the ward rounds. It's unimaginable in the current circumstances actually. So it's complete dedication, which I really appreciate, and I still keep telling all my junior colleagues here actually that's the way it should be. So I would like to thank everyone for on this occasion, taking this occasion. Actually, it's really thankful to all what you've done to make my career to what I am now. And all the skills, people say, okay, you've done liver surgery, you've done liver transplant. It's completely different to what you learned. But having said that, the basic surgical skills which I learned during my postgraduate days, that's what has helped me immensely. So topping up the skill with a bit more finish was not a huge problem. So I think the basic surgical skills is what matters at the end of the day. So if you have your basic strong, and it's easier to develop that further. That's what at least I felt. So thanks to everyone. So then I came here in 2002, and I had to do my surgical training here again, because they wouldn't recognize surgical training abroad at the time. So I was very lucky enough to do my surgical training in the region where I am now. It's in Birmingham, West Midlands. So this has got one of the biggest liver units as well in the country. So we've got 7 transplant centers in the UK. So this is one of them. So I was lucky enough to be in this region to do my general surgical training. And as a part of the training, I did 3 years in the liver unit, including transplant. And my focus and interest, although I did transplant as part of my training, was always to develop laparoscopic HPB surgery. I went to do a fellowship at King's College London for a year following my completion of training in the West Midlands. And then I took another year of fellowship in Royal Free again in London to do my transplant and retrieval fellowship. Completed that, and thankfully there was a job offer back in Birmingham, West Midlands as a consultant, which I started from 2010. So we just completed my 10th year last month. So I was. Why did I get attracted to liver? I think it's just combination of luck as well. My perseverance. I was keen to do liver. In fact, I don't know if Sarah remembers my research MS thesis was on cirrhosis, actually on portal hypertension with varices. My supervisor was Dr. Kate, but that was my interest. That's what started my interest in liver. And I was always intrigued by the way people find it extremely challenging. So when I was doing my general surgical job, I always used to think, well, liver surgeons are great. I want to be a liver surgeon one day. So, and luck played a huge part in my life as well, actually. So I happened to be in the place where this was offered, and job came up at the right time. So I would say I was lucky. And I don't still practice transplant now. I need to answer that question, actually. Why? We work as a team here, and there are enough people doing transplant here. But what the department was lacking at the time when I joined was advanced lab HPB work. So I wanted to develop that for the unit because we didn't want to be left behind. So we were ahead of the curve in most of the other things. Our research profile was good. Our transplant profile was good. We are doing pediatric transplants as well with our children's hospital nearby. But one thing we were lacking at that time was advanced lab HPV work, which was just beginning to develop. So that's one thing which motivated me to pursue the interest on that side, and that's what I like doing and enjoy doing. And I've developed uh, the lab HPB to a great extent, not just in our unit, in the UK as well. Actually, we have formed an association, and I run the training programs for that.
The greatest thing that I'm proud of about Ravi is that within 2 months I could distinguish between him and Ashok, which which many people, including Vikram, could not do for a long time. So
Dr.
During MBBS, but in MS, there was no difficulty.
so
Dr. Ilango Seto, who's very active on our Learning General Surgery group, is also logged in. Dr. Ilango, would like to hear from you about the same things that Dr. AK was asking his students, a different perspective.
I didn't start out to become a transplant surgeon. I certainly didn't. I did my MS General Surgery from Medical College Trivandrum with a lot of interest in GI surgery. Dr. Shubhlal is here. He was one of our inspiration. Dr. Ananthakumar was there. We had quite a bit of young surgeons who were very much interested in GI and pancreatic surgery. That was how I started. Over time, I was forced to be in general surgery for a long time before I could move into MCA general GI surgery. I came back to Chennai to do my MCA GI surgery from Madras Medical College. And towards the end of my training, Professor Ratnasamy actually encouraged me to do transplants. But given the family situation at that time, I decided to stay on in GI surgery because there were a lot of requirements to go to US at that time. You had to have a couple of years of tax payments post your MCH, must be contiguous years. So I had to work for that. You have to have enough financial resources to show that you can stay on in the US during your observership. And I had some bitter experiences during the initial procurement where we were observers. So I had to do a bit of reading. So my transplant training process was really delayed by 4 years. I worked as a GI surgeon in Chennai at that time, focusing mainly on pancreatic surgery and the routine GI stuff. But when I went to Pittsburgh, they told me that I had to do a multi-organ fellowship in order to train very well in GI, transplant surgery. So I took the offer with reluctant steps. That was my only transplant training experience. I had not trained with any other person, but I was very fortunate to have 3 or 4 people who were always with me and who could get me trained in kidney transplantation from scratch. Over a year, I did about 155 kidney transplants, which is quite a big number for that time. And it was an unforgettable experience because I did literally everything from skin to skin. So that was a very good experience for me. And once I crossed over to the liver transplant fellowship, it was pretty easy. I just had to mix and match the anastomotic techniques I had to learn. But then at the end of the training program, I realized, it is not just the ability to connect a few vessels and connect ducts. And I really had no knowledge of the science behind the liver transplantation. I was literally they trained me to be a technician. So these last 4 years after I've stepped out has been a daily learning experience. I have picked up most of the transplant technique. It's not the techniques. I'm still doing a lot of vascular surgery. So technical issues are not a problem, but I can see the enormity of the transplant related content, the training content, and it keeps me going. Just like how Sonal was saying that I was also very much interested in surgical critical care for my MS days. We were instrumental in starting the surgical ICU and running the core program for where the surgeons were managing most of the ventilators in the ICUs. So I was one of that. So I was very much involved in critical care at that time. Transplant brought back that love. I was doing a bit of interventional radiology during 2001 and 2005. That was very helpful. The experience in endoscopy and advanced endoscopy, I started pretty much earlier. They were helpful in small bowel transplants and assessing them. So those bits and pieces adds up to all your transplant training. And I think the best part of the transplant training is a confidence to operate on the retroperitoneal structures. Apart from that, I don't think so there is anything big in it. There are lots of challenges here in India, and I feel the learning never stops. For those of the youngsters who are really interested in taking this, they must commit themselves to a lifetime of learning, because new things are cropping up every day in transplant. But it is still a very interesting field. Thank you.
Ilango, I just one minute, Vidya, please. Ilango, I've just received a question on chat from one of my more recent students, Asim. And he asks, what is the way forward for people like me?
What is he an MCH GI surgery student?
He has done fellowships in colorectal. He is now going to do a fellowship in hepatobiliary, and he has done MS with us. And he is now in UK. So he wants to know where now.
So I'm a little surprised. I mean, there are two different pathways.
Yeah, I know it happens like that sometimes. Because you don't often get a choice of what you want to do, no? So you keep doing things till you get a job.
So if your interest is in HPB surgery and transplantation, I think the fellowship is the first step. You have to get to at least the basic HPB and the transplant program, and start the training. That's probably the first step. Do not feel bad that you are doing different fellowships. See, I told you, I was a diabetic foot surgeon. It's completely unconnected. Most of my practice was involved in pediatric surgery in 2002 to 5. But still, every bit of that experience was helpful. So everything you learn as a surgeon will be helpful in doing a transplant. And is it essential to train in transplant surgery? That is a call you have to take. And I think one of the questions which everybody asks during a transplant interview is whether your wife is okay with your training, with you being training in transplant, because they are the people who will suffer most because of your training. I mean, after all, for a matter of ego, will shatter your relationship with your wife, your children, and deform it in a way which you will never expect.
Ilango, Asim says he doesn't have a wife yet.
Yeah. I just noticed it.
But not for want of trying.
Sir, there are three categories of surgeons: those who are married, those who are divorced, and Indians. So those are the three categories of surgeons, transplant surgeons in the US.
When you say Indians, do you mean they don't know whether they are married or divorced?
No, I think their wives, our wives tolerate us, and our idiosyncrasy is much better than the other countries.
I'd just like to go over to Shantanu because it's an ungodly hour for him in Australia, but he's been nice enough to join. Shantanu, please unmute yourself and feel free to leave whenever you're too sleepy.
Thank you. Good morning. It's about 1 a.m. in the morning here, but it's really great to see Prof after about 30 years. I think I last left JIPMER in 1991, 92, and haven't really had a chance to catch up. So I think I just have been very lucky. I finished training in JIPMER and I went on to do my MS at Tata Memorial Hospital in Mumbai, and I was mentored there by another JIPMERite, Dr. Jagannath, who Professor Ananthakrishnan knows well. And after finishing my MS training there, while I was doing a sort of junior registrar, senior registrar role, Mohammed Rela from the UK came down to give a chat, and we got chatting afterwards. And he said, it was one of those blanket statements that people often make that, yeah, you get your FRCS and then come and we can sort something out. So I decided to do an FRCS. I did an FRCS as an overseas trainee, got it. And then around that time, we were seeing a lot of HCC, and the drive to go into liver transplantation and HPV surgery was to have another method to treat and manage HCC better. And therein started my journey in transplantation. And I think I was very fortunate that along the way, I met some stalwarts and excellent people. So I spent a year at Queen Elizabeth Hospital, Birmingham. And I think the reason why, and around that time, a lot of Indian doctors were in transplant was because we were the only people who'd be happy to wake up at night and go out and do a retrieval and come back in the morning to work, because we were trained not to complain. And the other thing we did not know, we never knew how to say no, which the local Western trainee is very good at saying. They're good at saying no. So I finished a year at Birmingham and then went on to do another couple of years in London at Royal Free, where I had the opportunity to see Dame Sheila Sherlock and worked actually with James Tulip. And on my last multi-organ retrieval from London, I bumped into a surgeon from Oxford, and he is a consultant, come out to do some organ retrieval. And we got chatting, and he said, well, you've done 3 years of liver transplantation. Why don't you do a year of kidneys and pancreas, and then that will make you a complete abdominal organ transplanter? And that sort of sounded like a good idea because I had nothing else planned. So I went on to Oxford. And the Oxford transplant program started while I was there in pancreas. And as fate would have it, I was the surgeon involved in the procurement with the first 10 pancreas transplants that we did there. And Peter Friend was the implanting surgeon. And he was suitably impressed. He was also the director of training. So after I nearly finished my year in Oxford, I had come down to SGPGI to look at a job and had interviewed, but then Peter felt I should stay on in the UK and arranged for me to do my training there. As it happened, none of my past training was recognized, so I had to do a full 6 years of carbon training. And I was asked by the training committee, what would you like to do? So I said, well, if I have to repeat all 6 years, I'll do only those bits of surgery that I've never done before. And so I got to pick all the other specialties where I had limited exposure. In my last year, I went down to Newcastle upon Tyne, which is another liver and kidney pancreas transplant unit, and essentially finished in 2007 and got onto the specialist register in the UK. And then came back to India. I spent a year in India and did a little bit of work in Hyderabad, Calcutta, and Bangalore. And that time we did a few liver transplants, fair number of kidney transplants, and did the first live donor simultaneous kidney pancreas transplant in India. And then, but I sort of struggled from a moral justification between corporate medicine and something like transplantation, because it was at the time, and I suppose it still is, a very expensive treatment modality, which often wipes out a family's financial situation. So I sort of struggled a little bit with it. I suppose having been in the UK for 10 years, I had been in some ways NHSized. I was looking for a public system which would support this activity. And so, well, I couldn't settle in the system. So I went back to the UK and then the jobs that were there were for renal transplant, so I went into renal transplant. In 2013, Adelaide advertised for looking for a transplant surgeon. This was a unit that had got scarred in the past with an unsuccessful pancreas transplant. It had been started by Dr. Mohan Rao, who's an Indian surgeon and a very, very old style Indian surgeon. I've had the chance to meet him. And so I thought it was a good opportunity. And when I was joining, they said, would you like to have pancreas transplants here? And so we said, okay. And so, yeah, the last 4 years, I've been here, and after a year of sort of observed practice by consultants here to be deemed at par and suitable, we started the pancreas program, and we have been active since 2018. And touch wood, we have had a very good run with 100% patient and graft survival.
Thank you,
looking
Shyam.
for Srinath. Srinath has joined, sir. Srinath, would you unmute yourself, please?
Yes. Good morning, Dr. Ananthakrishnan. Good morning.
Hello, Srinath. How are you?
I'm doing very well. Good morning. I just want to give a shout out to Radha Krishna. Radha, we are together in 8. And then
nice seeing you in a long time. Hi.
GVSN. Yeah, hi. GVSN as well. Yeah, good morning. Good morning, everyone. Yes, thank you for the invite. Thank you, Dr. Ananthakrishnan.
Nice to see you.
Thank you.
I told a little story about you before you joined. Maybe I'll tell another one later on.
Please. I would be delighted. I'm so sorry I was a little late. I was trying to set up a case and then I just got held up, but I'm here. Sorry for the delay.
So you can go now. You can start talking, Srinath.
The screen is
your turn.
Yes. Yes. So are you able to hear me well?
Yes.
Yes, fantastic. I just wanted to, I'm very, very grateful for all, for everything I've received in JIPMER. I won't speak a lot, but I can, all I can say is that, a career is like building a large building. So if you have a strong foundation, then you can build on it. And the most important thing I'm grateful to JIPMER is that I was very fortunate to work with Dr. Ananthakrishnan. And working with Dr. Ananthakrishnan taught me 2 things. One is it taught me discipline. That's what I learned from Dr. Ananthakrishnan. The second is he also taught me how to do the right thing for the patient. And third thing is he imbibed the maintenance of records and academics. I think that was those are the 3 important foundations for any surgeon. So I learned it from Dr. AK, and we used to call him Chief. I hope you remember that.
Yeah, I know.
Yes, we used to be, actually what had happened was we started off in unit 3A. It used to be Dr. Ananthakrishnan, Dr. Jagdish, Dr. Ananthakrishnan, Dr. Srinivasan, and Dr. Vikram was our senior resident. And I still remember at the head of clock 8, Dr. Ananthakrishnan used to come in a crisp white coat into the emergency room. Doesn't matter if you're up all night or not, you have to be there at 8 o'clock because he would start the rounds at 8. I mean, that is a discipline that I learned from Dr. Ananthakrishnan. And the second piece that is extremely important for the younger generation is that planning for surgery, and it's not the number of cases you do, I think it's how you do them. I still remember Dr. Ananthakrishnan took me through a sympathectomy, which is a very rare operation at that time, but the operation went so smoothly because he knew exactly where the planes were. It was a delight watching him do thyroids because he was always in the right place. And I think that discipline is what helped me a lot. And then after that, I was very fortunate to go to
I went to SGPJ. I don't know if Ravindra was there. I went there for a short time. And then I was fortunate enough to get a admission to MCH at All India Institute. And throughout, there are always Jipmerites helping me. Ravindra was there in SGPJ, and Radha was there in AIMS. So we worked together with Dr. Nandi, and that's where I got interested in liver transplantation. But the real story is Dr. Ananthakrishnan, I don't know if you remember this or not, but when we were postgraduate students, we had to present a case from New England Journal of Medicine in Lister Theater. Do you remember that?
Yes, yes, of course.
Yeah, and you gave
Yes.
me a case. You gave me a case of a fibrolamellar carcinoma of the liver that eventually ended up getting a liver transplant. So that was my my first introduction to liver transplantation, and that's how I got interested in it. So then I went to All India Institute, and All India Institute was great, but it was really hard work, and it was a different environment. It was not, Jipmer. It was not the comfy Jipmer. There were a lot of rough waters, but I did navigate the rough waters, and eventually did a lot of portal hypertension surgery. And I still remember to date that I had come for the exam, So the week before, they told me, well, your examiners have been set. And they said, Dr. Ananthakrishnan is going to be your examiner. I was so afraid.
Did you collapse with disgust or what? Again? Not again?
No, I was so scared. I said, oh my God, I cannot let him down because he's the one that trained me. It was more of fear of letting you down. So then, if you remember this or not, what had happened was Dr. Ananthakrishnan called me the night before, and he said, let's go for dinner. So here I am, an MCH student, having an exam on a Monday morning, and on Sunday night, I'm having dinner with the examiner. It was so gracious of you. So then we just chatted about the Jipmer, experience and everything, and he put me at ease. But boy, the next morning he grilled me. There were two candidates, and the story is that I got grilled more than the other candidate, and it was a delight. And to be honest with you, the only reason that I probably passed was Dr. Ananthakrishnan was gracious enough to get me through the exams. Then after that, I think I dropped him off at the airport, and we talked for a long time about liver transplantation, and he encouraged me to pursue that. So at that time, I was fortunate to apply for fellowships and got into the University of Nebraska. And that was really the turning point. And I had an opportunity to work with Bud Shaw. And because of all the foundation that I had, discipline, I would go to work at 6 a.m. in the morning. I would be ready about every single patient at 6 a.m. And for those of you that round with Dr. Ananthakrishnan, you know that even if there are 40 patients, he will spend the same amount of attention to detail to the first patient and the very last patient. So you got to know about everyone. So I think that really helped me a lot. And that was my turning point. I quickly realized that I had discipline, I had attention to detail, and every case I did, I got better. So that was actually very, very helpful. The basic training in Jipmer really helped me a lot. Thank you for that, Dr. Ananthakrishnan.
Thank you so much. You're done? No, wait, Vidya, I have to tell my story about Srinath. Can I tell?
Please.
Srinath, before I tell the story of what I learned from you, why did Govardhan leave transplant? Because that's one of the topics that I raised today. After spending so much effort, why people leave? Is it because the specialty is so demanding?
Yes, I think that transplantation is high pressure. You have to put in a lot of hard work. There is no room for error. If you cut corners, you essentially get punished. When you do the hepatic artery anastomosis or incorrectly, or you make the wrong decision of transplanting the wrong patient, the consequences can be quite devastating. So it's a lot of high pressure zone. And also with liver transplantation, it's not like if you're doing 150 livers, the livers don't come on Monday, Tuesday, Wednesday, Thursday. They all come on Monday. So you have to have the resilience and the stamina to do the transplantation. And truthfully, if you have a passion for it, liver is really the center of the whole body. And if you have passion for it, resilience, I think everything else will fall in place. So I think it's hard work. That's why most people opt out.
Good, Srinath. Coming to the story, you see, you said a lot of things about me, much of it undeserved. It's like Prince Philip. He once went for a meeting. You know, Prince Philip is not the most popular man in the royal family. And when people started talking about him, and I know my alter ego is AK-47. So when he suddenly got up to leave, and then they said, "Why are you leaving?" I think he said, "I'm in the wrong place. They're talking and praising somebody, and I don't know, I've come to the wrong place." So, by the way, I learned a lot from you, because my philosophy as a teacher was don't teach, because I was like Mark Twain. You don't let schooling interfere with education. You learn surgery not by listening to others, but by reading, by watching, by observing, by doing, and by discussing. So I don't think I ever spent a minute of my life formally teaching anybody. But the three things that I was very particular about was when not to operate.
Right.
And the second was ethics. And third was empathy for the patients, because, you know, Srinath knows, they were the fellows who used to lie on the road in the night before and come to the OPD next morning from long distances because they had faith in us. So we owed it to them to do our best. And that's where Srinath did his dissertation with me on the topic of testicular biopsy in tropical hydroseals to see whether large hydroseals affect the function and the morphology of the testis. So here was a young man. He came to me, "Sir, I think that what you're asking me to do is unethical. We are doing biopsy of," you remember?
Yes, I do.
You are doing biopsy of a testis for a man who has not come for that. Are we justified? And I was shocked because I was emphasizing on ethics to everybody. And I said, "What the hell am I doing? Have I made a mistake?" So I went and talked to Kumar Swami of VCRC, who was then in WHO. And he said, "No, we recommend it all the time." I said, "I have a student who thinks it's unethical." He sent me a lot of literature. I was also a consultant for WHO those days on vaginal hydroseals, because we are trying to develop a plan, and it was my theory that it's not as harmless as it looks, and it can damage. And morphologically, we have proved that by ultrasound, by showing atrophy, small size and all that. By doing sperm count, we had proved, but I wanted to see whether there is structural damage. And then I read all literature, and I wrote to people I knew in the WHO and to know that, should we stop this? What am I doing? And Srinath did realize the storm he had started in my mind. So I got a reply, and then I found that it's actually recommended because it leads to early operation and prevents further damage. And there is no proof anywhere in the world that testicular biopsy ever harms anybody by producing antibodies, because you're exposing the interior of the testis to the bloodstream. So it took me a month to collect all those references, and then I had the courage to meet Srinath and tell him, "See, I've investigated in great detail. I don't think what we are doing is unethical. I think we should continue." And then later on, he did excellent work. We published it and became the guidelines for the WHO, which then started recommending early treatment of a hydrocele to prevent testicular damage. It came in one of the monograms, and that is the ethics that I learned from him, that you don't advise others till you are sure of the facts. There is one more incident of ethics which I will tell when Rajesh comes. Thanks, Srinath. I have learned as much from you as you did from me, or maybe even more than what you learned from me. Thanks a lot. I hope you remember that episode.
Yes, I do very well. I do.
Yes, thank you.
We collaborated with Dr. Lakshmanan for that project. Remember?
Correct.
Yeah. Yes.
Correct.
And,
thank you. Very nice.
If it's okay, yes, very nice. I wanted to just shout out to Vikram. Vikram Kate, Dr. Kate is there. I just want to say hi to him.
Hello, Srinath. How are you? Actually, JVSN is also there, so both of you are co-pages. Remember very well.
And
I used to discuss about the cases.
They were great favorites of my wife, because she told me, Srinath and Govardhan, they are with you. Yes, I said they are the best interns we ever had in pediatrics, and they came there from there, and she used to inquire all the time about Srinath's progress.
No, sir, actually, he was with GVSN. Govardhan was
I know. No, GVSN,
yes,
that's what I meant.
Yeah,
GVSN Prasad.
Yeah, they used to always have tip for the cases, actually.
So Shanti was
good to see you,
fond of
Srinath.
them.
Good to see you.
Good to see you, Vikram.
Yeah.
Dr. Rakesh Agarwal, who's the director of JIPMA, kindly consented to join. Dr. Rakesh, would you like to say something?
Sir, good evening, Dr. Rakesh. Nice to see you, sir. Ananthakrishnan here.
Dr. Rakesh, are you there?
Yeah, I am there.
Yes.
Hi. Good.
We're not able to see you, sir.
Let me. Okay.
Yes,
sir. I have a phone, so.
Good evening, Dr. Rakesh.
Hello, good evening, sir.
Nice to see you, sir.
Same.
Sir, could you please speak closer to your phone, sir? Could you please speak closer to the phone? We can't hear you well.
Yeah. Okay. Now can you hear me?
Yes, sir.
So just listening to the stories, nice to listen to how things have gone over the years. Very interesting initiative, and great that many people from JIPMER have gone to such great heights in the field of liver transplant.
Dr. Fani Krishna, would you like to go next?
Firstly, thanks to Professor Ananthakrishnan for the invite. In fact, I don't know if definitely, Prof. I don't know if you remember at the end of 6 months of surgery, I wanted to quit surgery. And,
you're not the only one. I had another PG, Rajan, KV Rajan, who actually left. Vikram will know. He left and went to medicine and said, I had enough of surgery. And I was feeling sad because he was in my unit. But then after 3 months, he came back again and rejoined surgery. So you're not the only one.
So I don't remember exactly what we discussed that day, but after the conversation, I decided to join back. And the other thing,
do you regret that conversation?
No, definitely not. So definitely, that's the other thing is I was in a different unit with Prof, but one thing he always used to say whenever we met in the corridor, Funny, any time of the day I see you look like you just got up from bed. Why is it that? That was the commonest thing he used to ask me. So in our time, when we were surgeons, I mean, with you had Professor Ananthakrishnan, Dr. Kate, and Dr. Robinson Smile. It was predominantly the surgical unit was very much a GI unit. So any PG who came out of that, our aspiration was to join in surgery. But my interest in transplant really came after I became a consultant. I mean, the situation here in India, at least by the time when we passed out, at least our generation, by the time we passed out of surgical gastroenterology, was that they are the lucky few who sort of get into some institutes, AIMS, PGI, JIPMER, and they're sort of that path is set. There's some who decide to go abroad, but for the rest of us, once we get into private practice, we come in very apprehensive because once you come into the metros, it's a big bad world out here, and very, very apprehensive about our career. But for me, the big turning point was joining in a very high volume center, Asian Institute of Gastroenterology. And even now, when youngsters come to me and ask me what next in your career, I said, just forget about earning, career, and all that. For the few years in life, just do a lot of high volume work. What that did for me was being an Asian, it was a factory show. I was in a, it was like factory floor, 6 days a week, Diwali, Christmas, New Year, anything we were working, and daily 7 to 6:37 for 12 hours a day I was operating for almost 3 years. So in those 3 years, the kind of the volumes which people achieve in probably 10 years, 12 years, we did it in a short time. And that sort of gave me the confidence of, okay, I've sort of really felt, maybe fellaciously at that time, because I was still young, I felt I've mastered GI surgery and now there's something I need to look beyond. And that sort of got me interested in liver. And liver was a series of just lucky coincidences, because when in Sanjay Gandhi, I got a fellowship in Japan for hepatic oncology. I spent 6 months there, and there was not much of liver work being done in Asian. So I started doing a bit of liver work, and that slowly got me into interest in transplant. And at the same time, one of our bosses, Dr. Rajendra Prasad at Leeds, took me there for a transplant fellowship. So I didn't really have to chase it or something. It came naturally. And by the time I came back to Hyderabad, the transplant program at Asian was taking off. So that way it was this thing. And so we, after coming back to Hyderabad, the Asian program was taking off. And by a really young age, by 36, I was leading my own transplant program. And my career has one more this thing, so which sir was asking, how did you, how do some people in transplant move out of transplant back into surgical gastroenterology? So at least here, I mean, in India, one thing about good or a bad thing about transplant surgeon is you are a function of the place where you work. I mean, you could be a terrific transplant surgeon in a place where the huge amount of cadavers coming in, doing 10 transplants a month. You go to another center where there's no cadavers, there's no medical gastroenterologist, you could really turn to this thing. So at that point in 2014, because of a lot of personal crisis in my life, at that point I really decided that I don't want to work in a big hospital, and I wanted my own island, and made a major decision of starting my own center in Hyderabad in 2014. So once I came in, these few years, I sort of moved away from transplant. I mean, I was still getting a lot of patients for transplant. I was transplanting them outside in different hospitals, but I found it that I was not able to do justice for them because I was doing my high volume work in my center as well as visiting the hospital 4-5 times a day. Then I started listing patients with my colleagues and other friends, so with other transplant surgeons. So I was still technically involved in transplant, but in transplant, unless you really have close follow-up, you sort of lose ownership. So, but in these 6 years, slowly we've sort of, our institute from a 25-bedded, we made it a 150-bedded institute, got an NABH, got a DNB program, got a, vascular a cath lab, and now we've got a transplant license, and now we are back to doing transplants again.
If you have a chance, Funny, would you do something else?
No, definitely not, sir. Because for me, the attraction for transplant is one is the technical excellence, and a person doing a transplant is a very complete doctor. He's not just a surgeon, but he's a physician, hepatologist, and an intensivist combined. So it's a very exciting field, and the confidence that the transplant gives you, you are able to handle anything, makes you a much better GI surgeon. I went into transplant, I came back, and I felt that the confidence of being able to handle anything makes me a much better GI surgeon, not just as a surgeon, but even when I'm training the youngsters who work with me, I'm confident that I can handle any situation which, if something happens.
Thanks, Funny. That's very interesting. Thank you.
What Funny is saying, like what I tell my juniors, that you should do at least 6 months of cardiac anesthesia, even if you never want to do any cardiac surgery, but spend at least 6 months doing cardiac anesthesia. Once you do that, then you're not scared of anything else that happens in any other surgery. So yeah, not like all of you have been saying, no training ever goes waste. Everything you learn is actually going to make you better in the field that you finally choose to go to. So I'd like to go next to Rajnikant. Rajnikant, are you there? Rajnikant, are you there? I can see him logged in, but perhaps he's stepped out. So we've been talking about people who trained in JIPMA and general surgery, but there was no liver transplant going on in Jipmer till very recently. So we'd like to hear what is the current scenario from Biju. Biju, would you like to unmute yourself?
Yeah. So the basic interest, as all surgeons know, the surgically, I think the complex liver surgeries or hilar surgeries will give you more satisfaction, surgical satisfaction than a transplant. Because transplant is 90% mostly a uniform exercise and all. So that was my original interest was that. And second thing is, of course, the visits or working with Dr. Tan and Strasbourg and other people really helped in conceptualizing. But what is motivating you always as Dr. Ananthakrishnan, the huge queue of people who cannot afford anything apart from this, apart from simply opting to die. So that will keep on motivating that there is a need for the organ transplant in our country. That is the main motivating factor. So, with respect to Dr. Ananthakrishnan's question, why people are dropping out, I believe that the transplant, as Dr. Sonal told, hardly it is 30% the surgery. Rest 10, you are a hepatologist. Rest 10, you are a intensivist. And rest 50, actually, you are a team leader, motivator, logistician, or an administrator. So, if you are not able to do that 50, that is where the dropout really happens. Actually, that makes people drop out. So you don't want to create. You are not able to create the system which you prefer. All this demotivating and actually what Dr. Sonal told me, may underestimate. I feel so. Maybe more than 50% who are actually had a professional training in transplant, we are actually unable to, our country is unable to utilize that exercise, their skills. That's the real fact. So that we have to address very soon. Where Jipmer standing, we have started our liver transplant program after kidney very soon, very last 3 years only. So the thing is, the amount of patients we are getting, the wait list, the second opinion consultation, whatever, from all peripheral centers, we have a huge health problem of patients not undergoing transplant in India. That is our major crisis. So I don't know whether our director is still here, but what we as a department and as an institute and JIPMAR, we have to do something in this. That's what probably were, since all JIPMArites are here. So we are conceptualizing, as you know, Institute of Organ Transplantation. So probably the plans are in the middle phase. We acquired the land, we have conceptualized the building, how it should be. It's basically a 450-bedded only transplant hospital. We already conceptualized and planned everything. So this is not just doing the clinical work only. So it will have divisions of all the transplant, renal, kidney, pancreas, intestinal failure unit, and transplant biology, transplant immunology, transplantation research. So it's a one-stop shop building for all the transplant activities. That's what. So the planning is almost complete. We had building plans ready, architectural consultant, engineers already on the job actually. So it may take some time to develop, but probably if it materializes, I think JIPMAR will cater a huge demand of the patients as well as the skilled, more skilled manpower needed for the country in terms of surgeons, hepatologists, anesthetists, researchers in the transplant, and third parties. It may what is lacking in India, probably the research related to transplant. It's really lacking, especially the research, fundamental research in terms of transplant. So probably what we have planned is that we'll have artificial engineering, bio cell engineering, artificial cell generation, GMP facility, everything we have planned in the building. So once it comes, probably if it materializes as we envision, probably these things will, in the transplantation scenario, this probably will make us Jipmerites proud and keep going in the transplantation. That's what I wanted to tell in this. Second part, as Dr. Sonal told, very recently, how to tackle this, you say 20, what people say is 25 lakhs, 30 lakhs, 35 lakhs, all these people cannot afford at all. So recently the National Health Authority formed a subcommittee how to crack this and how to make it more affordable. So we had a subgroup in this in terms of liver, in the area of liver transplantation. So Dr. Soin, Dr. Subhash, Dr. Pamecha, Dr. Philip, myself, we were the 5 people in the liver transplant scenario, how to make it more affordable. So finally, with all the permutation, combinations, calculation, all the scientific assumptions, we zeroed in approximately around 10.5 lakhs, which we can make it, and probably government might be willing to support that amount. So that probably that decision is almost taken, and this will be a benchmark of all the insurances under the government of India. Probably government of India is going to make this liver transplant affordable by offering direct payment or direct insurance under the government of India for all the centers, whether the private or government. So this will be another turning point in the liver transplant. So the huge, you are converting something like 1,500 numbers to 2,000 in India, converting to 10,000. These are the this may be a game changer in the year. So these are the 2 things I wanted to tell. Thank you very much for the opportunity.
Srinath, is it the same in US also? Is 50% of your time, or is it better structured? Like, obviously, any transplant program, anybody working in a transplant cannot just be operating. There is more to it. That is a given. But is it as difficult as Sonal and Biju are describing in the US?
Yes, that is actually the beauty of the job, because as a transplant surgeon, you're a complete doctor. You make decisions on who to operate on, who not to operate on. And that's something I learned from Dr. Ananthakrishnan, that a good surgeon operates from the brain. So even if you are a really, really good surgeon, but if you pick the wrong patient, you'll have a bad outcome. So I think that's extremely important. So that comes in. So you have control not only on the surgery you're doing, but the person you're doing surgery on. The second piece is that liver transplantation, in my opinion, is the most complex surgery that you can ever do, especially a living donor liver transplant, whether it's the living donor hepatectomy or the implant, especially pediatric transplant. So once you can do a liver transplant, everything else is something that you can very easily do. You will know your way around the abdomen. And in fact, at the program here, I lead the liver transplant program, but all the hepatobiliary surgeons, when they have a complex cholangiocarcinoma or carcinoma of the pancreas that's infiltrating the portal vein, they usually call transplant, so we help them. So I think that doing the surgery, you will, as a liver transplant surgeon for the younger generation, you'll be able to do anything after that. And the third piece is that post-operative care is extremely important. You could do a good operation, but like you said, if you don't do good intensive care, then the outcomes are not good. So the major advantage of the being a transplant surgeon is you're a full-time doctor. You kind of, you teach, you learn from others. And a lot of the times we learn from intensivists all the time. We learn from hepatologists. So it's actually a very collaborative, cohesive group. Now, if I can take this opportunity, I don't know if there are any young residents or young students on the call. The most important thing is follow what Dr. Ananthakrishnan has told you. Number 1, know when not to operate. Number 2, be ethical. Don't do a surgery that is not necessary. And the third and most important thing we learned from him is to be considerate to the patient. I still remember that people will come from faraway places, sleep outside Gormedu. They'll come in so sleepy, etc. I mean, those are the people that I think deserve our respect. I think if you follow those 3 things, boy, whether you are in Chipmur or R&D Institute or University of Nebraska or Baylor, you will never fail. You'll always succeed. So that is my 3 comments there.
Biju, I want to express my opinion that somehow this insurance and affordability issue has to be solved very fast in India, because you are aware and I am aware, and that many of the organs are going to foreign recipients because the Indians who are in the list cannot afford it. And that's rather sad. And this has been going on for a long time. There's a lot of talk about this insurance and bringing down the cost, but very little has been done to my knowledge. And those of you in the field have to work towards seeing that at least 50% of the organs that we retrieve in India should go to Indians, because they are just waiting for a long, long time, particularly heart. Most of the heart goes to recipients from the Middle East. So it's something of great concern to all of us.
If I may just add a couple of things, if that's okay. Regarding affordability, that's sort of the bugbear of transplantation in India, as Biju correctly points out. Clearly, doing more transplants in the public sector is an important thing. And so far, apart from ILBS and JIPMA, no other public center has managed to do significant volumes. That is a very big step that needs to happen, and I'm sure the institute will help. The affordability part is, I think they don't think there is only one solution to this. We have looked at, the NHA is one clear thing, as Biju said, coming out with a uniform definition of what transplant costs. And another thing is something like we created which works very well for children, for example, using crowdfunding. So over the last 3 years, we've raised approximately 9 crores of funding to fund about 98 pediatric transplants. And we do pediatric transplants for 2.5 lakhs. So that's cheaper than most kidney transplants these days. I think that those are things that, I mean, in a setup like India, we can't expect the government to do all the heavy lifting. CSR, crowdfunding, everything will have its role. Those are discussions that are happening at different levels. And regarding sort of the organs going to non-Indians, that's always been a very emotive topic. But I think that is just sort of evolution playing out, because in the early days, liver transplants were being also offered to non-Indians. And gradually, as the numbers and the volumes built up, we don't see that happening anymore. So I suspect that the different solid organs are going through a phase where hopefully within 2-3 years it would be it would be quite unusual to come across organs being offered to people of non-Indian nationalities. And Biju, by the way, I'm a professor at the Indian Institute of Science at the Department of Biomaterials. I was quite interested in your cell biology thing. So I teach there 2 days a week. So if you want to discuss that offline, I'm happy to do it anytime.
Oh, thank you.
We should all be having each other's emails, because I put it all together. That was my thanks to you for agreeing to join.
Where, Vidya? I don't see it anywhere in the list you have sent me, the email.
No, sir. You were copied on the mail, the link as well as the questions, everything I sent to all of them together, so that if they wanted to talk to each other later, they can do that. So
Yeah,
everyone, sorry, sir.
Their emails are not there.
I will send it to you, sir.
Okay.
So almost everyone was spoken till now had some training abroad. But so I would like to hear from Rajesh, who's done, from what I understand, his entire, including liver transplant training, was here in India. So I want to know whether he thinks it's an advantage, or does he feel that he's in some way having a handicap, trained outside.
Thank you, madam. Thank you, sir, for the opportunity. In fact, I wanted to start with saying my fond memories in JIPMA. I got my Stanley MSc but I was waiting for, I was on a waiting list candidate for MS in Chipma. I desperately wanted to do surgery. My passion was surgery, and I wanted to do in Chipma. When I got it, I was so happy. And to mention few things, many things has been shared by many of the senior surgeons. Few things is, one is in Jipma, whatever basic surgery, thyroid, hernia, GJs, the way you do it, everything. The first surgery will be assisted by the consultant. This is never done anywhere in any of the, I talked to many surgeons and never done by anybody in the country who I know of. So that was like they teach us, they take the fear out of the surgery. And the one specific incident I remember is about your the attention to details. We had a case every afternoon, we have a clinical case scenario session where a case was brought in the thigh there was a swelling, not thigh, leg, there was a swelling, and then we were in S3, and then the patient was brought from the S3 OPD, and then we were thinking in all terms like or tumor from the bone, all the discussions are happening, and Professor Ananthakrishnan, he came and then he went and then he spent 10 minutes with the patient, and then the case actually was a chronic hematoma with a partial muscle rupture. But the 10 minutes he took, and then the question and the examination, exactly he mentioned what it was. It is that day, it was about attention to details, how you put your efforts in getting. If you're interested in something, you need to put the effort, and then you will find it. Just wanted to mention that. Thank you, sir, for that lesson.
Thanks, Rajesh. Thank you.
Thank you, sir. So moving on, in fact, JIPMA opened the surgical world for me. I got an opportunity. Exposure was more from JIPMA, and then I moved on to, along with my colleague Kalayarasan, we got my MCH in GB Pant. I had 3 years of training. Even after my gastroenterology training, I felt a lacunae. I still had the fear of touching the liver. It was there in my mind that I can't do a major, my training is not complete. So after 3 years, when I finished my MCH, luckily, I wanted to move down to South India, but luckily, Professor Muhammad Rela was here. So he has just moved from UK to India. So I waited for almost 1.5 months. He interviewed me, and then I got selected. Though I got selected, the first the few days itself, I realized that I was surprised by two facts. One is liver is such an interesting topic, not only from the surgical point of view, but as Fanny rightly said, hepatology, immunology, it's a completely different, transplantation is a completely different, you have to start from square one, though along with HPV surgery. The second is the amount of time, hard work you need to put. You have to sacrifice your personal life. There is no second thought about that. So that few days itself, I have to take a decision. Luckily, I was the family was supporting. I was in addition, I was able to go ahead. I joined as a registrar first, and then it's almost like I finished my fellowship. It was almost like 3 years. Then, or the next, now it's almost like 10 years in the transplantation field. But what I learned over the years is, one is patience. Don't waste your time thinking that you are not operating when you're in transplantation and then just you are doing the regular. But observation helped me a lot. I learned a lot by others operating, by others taking decision. If they ask a question to the patient, I think why they ask, what is the thought process. All these things, if you have the passion for it, you will definitely learn things much quicker. And the do's and don'ts, by looking at the surgery, the surgeon operating itself, you will be. And I always feel that liver transplantation is one field where the chancer term, the Professor Mohammed Rela used to say that, it is that you have to wait for your opportunity with patience. And once you get an opportunity, you have to prove yourself. That is where actually I'm like many times people fail, but you have to prove your opportunity. And this is one field which will show off your basic skills, defect in your basic skills very, very openly. Like If you are not able to do one proper anastomosis or dissection, then you will go down and then you have to again climb. So this is one field I felt that this is one reason I felt JIPMER. I really thank JIPMER for laying the foundation strong for me. Luckily, as of now, things are good, and the workload here is so much that we got exposed to not only disease donor, living donor, domino, split, pediatric, whatever. So I'm thankful to my alma mater, JIPMER, for that.
Thanks, Rajesh. Thank you so much.
Thank you.
Dr. Sendil Kumar, are you there? Please unmute yourself. Dr. Sendil Kumar. Dr. Rajnikant, are you there? Dr. Rajnikant?
Hello, can you hear me now?
Yeah.
Hello.
Yes, we can hear you.
Hi, Sendil, how are you?
Hello, sir. Good evening. So looking forward to this. Thank you so much, Dr. Vidya and Dr. Radhakrishnan, for the opportunity. So nice to see sir and rest of our JIPMER family. So I think all of speakers who spoke before me have sort of stated what was important and condensed it so nicely. All I would say is I learned my liver transplantation in JIPMER. So
Hey.
I learned it from Dr. Ananthakrishnan. The reason I say this is liver transplant is nothing great as long as you have your foundation laid strong and clean. So that's what it's about. It's just a slightly different canvas. As long as you have your basics, basic learning done properly, then it's nothing. It's not a big deal. So that's why I say I learned it in JIPMER. So you're so lucky, all of us who are in this forum now, who have been through this wonderful factory of JIPMER, so well nurtured right from the day we stepped into the unit. And I was so lucky to be with sir all through my stay in JIPMER, even my SRship, except for a few months. So as others have nicely summarized, it was about creating a rounded person in you, not just about technical skills alone. It's about decision making. It's about being empathetic. It's about having an eye for research, academics. You come out as a rounded person. You can't help it, even if you are really poor in all of these areas. You come out as a rounded person just by being in the field, just by being around. That's what JIPMER made us. It sculpted us from whatever we are. So I'm so very grateful to sir, particularly, and the rest of us. Dr. Kate is there, I think, as well as. And we all in the same unit.
Hi.
And as far as my journey is concerned, I spent. Hello? Can you hear me?
Yes, Sendil. We can.
Hello.
We can hear you.
I'm sorry, having a very bad connection here.
No, we can hear you.
Continue.
Hello.
You're audible. Continue.
You are audible.
Sorry. So yeah, as far as my journey is concerned, I finished 3 years of SR in SIR's unit, spending most of the time in SIR's unit. And after that, I went to UK, spent about 14 years in total, rotating through various specialties. And then my liver training was in Royal London and Birmingham as well. Before I came to ILBS in India, I spent about 6 years there. And right now, last year I came back down south. I'm right now in SRMC Poro. As far as the advice to juniors who might want to take career in liver transplant, I would say you have to have a passion in this, and you have to, as others have said, you have to put in the hours. That's very, very important. It can be very taxing, and that's probably why people burn out. So that's from me.
Thank you, Sendil.
Dr. Venugopal was doing a transplant and he's, I think, finished and just joined. Dr. Venugopal, would you like to unmute yourself and speak?
You have to call him Kota.
I'm really sorry. I think it's
Kota.
It's cut off again.
Good evening, sir. Good evening, all of you.
Hello, Kota.
Yes, sir. How are you, sir?
I'm fine, thank you. How are you?
Fine, sir.
You become younger, man.
Sir?
Thanks.
You become younger.
Oh,
Oh, thank you, sir.
So.
Actually, I didn't get the mail. Just check the message mail. But from what I surmise, I think what I wanted to say about my liver transplanting is basically if I question myself how I became or landed up in liver transplant or became, because I didn't have any specific special training for this except working with Dr. Rela for about almost 12 years there. So I think reflecting back the basic principles of surgery, how to, like as a surgeon, you obviously have to operate, how to handle the tissues, how to take care of the incision, closure, how much traction to pull, everything, the basic principles of surgery, the do's, don'ts, everything were firmly inculcated in us in JIPMER. That's what I thought, because if I question myself, I cannot find anything different, because these are the things which put us in good state in handling whatever surgeries we do. And liver transplant, I feel, is a surgery where meticulousness is very, very important. A small stitch here and there can make a lot of difference. And there is no, you do not get a second chance. If you are a kidney transplant, at least you get a second chance or you have an alternative of dialysis. But in liver transplantation, especially, every stitch from beginning to end has to go as per clockwork precision. And if for that, if you have to have the skill, the technique, the proper strategy, and the ability to execute that one. So this is how for a liver transplant surgeon, but I think the same holds true for all specialties. Because I'm working in liver transplant, this is what I thought is important. And it's seeing over the few years how medicine and surgery has expanded. I feel I do not know more than 5 or 10% of basically liver surgery or liver possibility, what is happening now. And to say like in general surgery, you are in liver surgery, liver transplantation, it's not possible to get all the information. So at least what I think this properly and use the cases you see, that's an opportunity to read, learn, discuss, or compare anything and remember for later on usage as well, because that's the best way to learn, because it's not possible for any one of us to learn the whole field absolutely. So whatever opportunities we get, try to get the best use of it. And obviously you see your peers, seniors, juniors, and obviously working in a group helps a lot, because each one will have different techniques, different views, different opinions, and there's also an opportunity for discussion when you're in a group. And I am extremely thankful to my teachers at JIPMER, because I felt that that is the turning point in my life. But I never wanted to be a transplant surgeon. It was never one of my dreams to become a transplant surgeon, but it happened. I'm good at it, but that's how it is.
Thanks, Kota.
Rajnikant, would you like to go next? Rajnikant?
Yes, madam. Yes, ma'am. Hello. Sorry, in between my signal got cut. Good evening, sir. Professor Ananthakrishnan, sir.
Hello, Rajni.
Hi, sir. And good evening, Professor Vikram Kate, sir.
Hello, Rajni. Hi.
Hi, sir. I'll start 3 subheadings. My thing. One is a JIPMER experience.
Your
Second is my journey.
video's not coming, Rajni.
Sir. Now?
Yeah, now it's coming. Yeah.
Yes, sir. Yes, sir. Thank you, sir. I'll start in 3 subheadings. One is my JIPMER experience. Second, my journey, and advice to the new trainees. Many of previous colleagues have rightly mentioned we are all very fortunate to have training in JIPMER, and I was very fortunate to work in under Professor Ananthakrishnan and Professor Kate, and it has given a strong basics And as they mentioned, the ethics and passion towards surgery and when to not operate. These things I learned strong basics in Professor AK's unit. Also, whenever we work in JIPMER, in Professor Ananthakrishnan's units, it's a natural tendency to develop GI interest. And in that, subspecialty wise, we develop interest in pancreas and liver. So that's how I developed my interest towards that. And after I did my MS there, I worked as a CSR for 1 year. Then I moved to UK. And UK also, I worked in surgical gastro. Then I had a opportunity to join in King's College Hospital as a hepatobiliary fellowship. After that continuation, I got a fellowship in liver transplant surgery. This has given me a tremendous opportunity and experience. From there, I worked under Professor Nigel Heaton and Professor Raila. So Professor Raila, after finishing my training, he offered me a job in India. That's how I came back. And this is my journey. Regarding the training in liver transplant, it is a very hard work. In King's College, they say you need more than 10,000 hours to get confident in liver transplant surgery. Either way, you have to be in 10,000 hours in theater, either assisting or doing or retrieving, whatever put together. As a trainee, this is how Professor Nigel Heaton used to say, you need to have this much of training, then you will be confident in doing transplant. Technical competency you will develop. And especially in liver transplant, he used to mention that the psychology of the surgeon is very important. The character and mainly the team player. You have to be a team player. You cannot be an individual surgeon in liver transplant. You have to adjust the roles and it will change, keep on changing time to time. So you have to adjust your roles according to the team requirement. This is what they trained in King's College. So it's a multidisciplinary team. You are not at all the center point. Everybody helps you around, including hepatology, ICU, interventional radiologist, pathologist. Everybody is there in this framework. So then only you will be a successful liver transplant unit. For new trainees, the liver transplant is a great field if you are ready to work with passion, and if you can put hard work, that long hours, and obviously family, obviously the other half will get sacrifices. You have to take them into the account. So overall, this journey, I really thank my experience in JIPMER that has given me initial foundation in the sense, not only technical aspect, how to work hard. In JIPMER, you work hard, long hours, and next day you have to carry on and you have to present, you have to do journal clubs, you have to case presentations. All this makes you a tough person for higher career. Thank you very much, sir.
Yes.
Dr.
Vidya,
Dr.
can I
has joined in.
Can I say just one word, Vidya, please?
Absolutely, sir.
Yeah. See, hearing all these boys, we should not go away with the idea that surgery in JIPMER is one-man department, because we had some very excellent people. My colleague Robinson Smile,
yes,
to whom I will go any day if I need surgery, and I know he will come to me, and he has shown that he will come to me when he needs any surgery. We had some very talented youngsters like Dr. Sarat Chandra, who has now become extraordinarily good. Dr. Kadambari, who is now a very, very talented breast surgeon. We encourage them to take different fields. And when I had to do Whipples on the Chief Secretary of Pondicherry, I think I told this story before.
Yes, sir. I was assisting. I was assisting, sir.
Yes. The first man I say, Smiley, you better come and stand around because I don't want any mess happening and I want your help if I need. And he just waited patiently for 3.5 hours. It will be finished. So it was one of the departments which had absolute unity, both within itself and with the anesthesia department. And Vidya asked me once that what are the relationship, and I said it was excellent, although I just joked in the beginning. We never had any problems with them, and I hope they didn't have any problems. So remember, it was never a one-person department. Many of these people worked with Smile and others. There was Jagdish, there was Srinivasan, and so many other people. Each had his own contribution to make. And that is how the department grew. I just happened to be the head, but it is to all their credit that these boys or gentlemen have developed.
Thank you, sir. And one small thing to forget to mention is the professors and students, they are so brilliant. The important thing is the senior residents in JIPMAR, they train the first year, they already have the structure and how to train juniors. So I'm fortunate that my SR was Dr. Kota Venugopal. He has trained me in my first surgery.
Okay.
In JIPMAR, my first year, he was my SR. So it's a great thing to have a senior residents like that. That helps a lot, actually. Thank you, sir.
Thanks, Rajni. Vidya, all yours.
You were looking for Srinivas Reddy in the beginning, sir. He's joined up. Srinivas Reddy, would you like to unmute yourself and speak?
I have to tell Srinivas, I spent 24 hours, Srinivas,
yes,
and I blamed myself. How come I do not remember Srinivas when I remember every postgraduate who worked? And then finally I solved the mystery that you didn't do PG, you did only undergraduation at JIPMAR. And I rang 7 or 8 people, woke up people in the middle of the night like Nand Kishore to find out. I say, what the hell? I'm becoming senile. I've forgotten which unit Srinivas was. And Shantanu. And then they said, no, they didn't do PG here. They did undergraduation. And that's, I slept after 4 days, knowing that I had not become senile yet. So nice to see you, Srinivas.
No, thank you, sir. Thank you. I mean, thanks, man. Actually, I mean, I remember you very well, obviously. Your lectures were when you came to take lectures for us in surgery, they were brilliant. Actually, I mean, in fact, we could just read whatever notes you told us during the class. That was enough. Actually, more than love and daily for us.
Thanks, Srinivas.
Thank you, sir. Thank you. In fact, you were my DNV examiner also when I had my DNV exam in MMC Chennai.
Yeah, I become very tense when somebody tells me that, because the next question I want to ask is, did you pass or not? So, just now Srinath told me how he got scared of me. So my reputation not very good, but it's much worse than actually the results are. So, and people like Vidya spoil it all the time by calling me AK-47.
We used to be quite scared of you, sir, when we were in. Obviously, we were scared of all professors when you were an MBBS student.
I am more benign than a lipoma, man, I tell you. So, only look malignant. So, ask Rajni, he'll tell you. I am not so malignant.
No,
Yes, sir,
I
yes, sir.
think
Definitely.
Yeah, I work with Rajni anyway now, so he does. I mean, I think like Professor AK said, I did only my MBBS in JIPMA. So all my surgical training was, I did my MS and series in Chandigarh, and then went to the UK for 8 years, and then I came back and worked with Professor Rela for 8 years in Chennai. I think in terms of JIPMA, I mean, as an MBBS student, you don't really remember a lot of things. except that you had a lot of fun. But I think one thing that I'll never forget is probably the strongest thing that JIPMA teaches its students. During our internship, we had a 2-day session on ethics in medicine. So it was like short videos, role plays. I remember Dr. Jagdish was playing a role as a patient, and a doctor comes and talks to him. Dr. Sethuraman was I think these are all small videos that were made, and we had it was like a small video clip, and then we discussed what could have been done, how we would have dealt better with this patient, what is the right way to deal with this kind of a case. I think those are something that you never forget. If there's something that I can say JIPMA has taught me, it is the fact that the patient also is a person. You need to treat them as a human being, and you need to be fair to everybody. You need to treat everyone, your colleagues, your patients, your juniors, fairly, and as you would probably like them to treat you. I think this is something that I'll never forget from what I learned in JIPMA. I think in terms of transplant, I think everybody has said a lot of things, so there's nothing more for me to add. The only thing is, like some said, family does take a hit, family life, which is unfortunate. We need to try and try our best to work with your career and your family to so that the family doesn't really feel left out. But I think transplant per se is a team effort, and you make really good lifelong friends actually as in this team. Very unlike other surgeries where you are a surgeon, there's an anesthetist. Actually, you work together with everybody, and actually you the kind of bonds. I mean, I worked with Rajesh for 8 years now, and I think that's the kind of relationship that you have. It's not something that you will see in other specialties. That's what I feel, because you're working through at 2 o'clock in the night. You're trying to sort out a case and operating retrievals. These are some things that you will never forget. I think that's how. I mean, it is a difficult specialty, but I think it's a very you do feel happy at the end of the day that you're doing something good. Thank you. I think.
Thanks, Srinivas. Thanks a lot.
Thank you.
Do we have any hepatologists on board?
What about people like Kalayarasan and all waiting from the beginning, Vidya? They don't want to...
Yes, sir. I just thought we'll wrap up with the transplant people before we go to those who are doing HPP. But yeah, I mean, I just wanted to give a chance in case somebody was waiting.
Okay. Oli Chelvan is there, hepatology?
No, he hasn't come. I think he hasn't joined. He said he has some endoscopy list today, so he may not be able to join.
In the middle of the night?
No, sir. He's in UK, sir.
Oh, I see.
2:30 in the afternoon or whatever. Kalarasan, would you like to say something? And I think Magnus is also waiting.
And Vishnu.
You go first.
Yeah, I don't know. Dr. Magnus wants to speak. So you can.
No, you go ahead, Kalarasan. We'll go to Magnus next.
Yeah, sure. Yeah, thank you, ma'am. Thank you for the opportunity. It's a privilege to be part of this. I mean, to start off, as everyone mentioned, it's important to have a good foundation, and I was lucky to be part of the Unit 1. I'm saying lucky because we used to have the lots. I mean, because the units are selected by lots on the first day. So that maybe probably the luck started on that day for me. I just want to say one thing. Maybe if I hope sir doesn't see this. I'm happy if he doesn't see, because he will not like. So I use this PowerPoint in one of my talk. It's something very appropriate, because I'm fortunate to be trained by the God himself, because it's there in his name. And
No,
was
no, no,
lucky
no.
because the reason I say, because my relationship with sir is more than a simple a teacher or a student. So he has been someone who really shaped my both academic career and also the personal career. So that way, it's I'm really fortunate to be trained under him, and also Mr. Kate sir, because I mean we learn so many things from both of my teachers. And Kate sir, he actually looks into even smaller aspects during our training. He makes the scrub list, which is supposed to be one of the unique thing which used to be in the unit. So we know the day before who is going to which case, so we can prepare well. And we also know, like, you are the first assistant, you are the second assistant. So that systematic training is the one which really shapes one's surgical career, and has been rightly pointed out by everyone who's spoken before. And that's something which I consider myself very fortunate to be part of it. So coming back to second, with respect to the liver transplant, as something which is which was told by others. So when we do our training, so the liver is something which is very fascinating. So because partly you don't have enough exposure during your residency. So once I completed my MCH, so I had 3 months training in South Korea. So I chose this liver surgery and liver transplantation. But that time, although I developed interest in the liver transplantation, but one thing which maybe prevented or raised doubt in my mind is, as pointed out by Dr. Biju also. So liver transplantation is not just about the surgery, but you need a team and a team effort, and you should be a team leader. I always wanted to work in an institute setup. So I was really not sure whether I would succeed in establishing a transplant unit. So that's the only thing which created a doubt in my mind. And so frankly speaking, my interest is more with minimal invasive HPB surgery. That's the reason, as I mentioned, is partly because transplant is not just about the surgery, but it involves a big team. You need a support from the team members, and also you need to be a good team leader to take everyone together, which is probably, I feel it's easier in a private setup, and it's really challenging in a public setup. So that way I admire what Dr. Vidya has done. So, but I feel that it's important for me to be part of the team because what I didn't have during my training. So I feel the residents who are doing their training during MCH should have exposure to the transplant. So that really helps them to decide whether they have to take that field or they want to take some other thing. And also the second most important, probably that should be the first also, because not every patient who requires transplant is getting right now because of the financial reason, as rightly pointed out by the previous speakers. And as an institute, so we should be offering to at least some of the patients who needs this transplant. So these are the two factors which really keeps me as a part of the team, although it's not my, if you ask me the option, what's your first preference? My personal preference is actually a minimal access surgery, but these two things keeps me as a part of the team. So once again, I thank everyone for the opportunity, and I again thank all my teachers who helped me to shape my career. Thank you, sir.
Thanks, Kalai.
Dr. Vishnu, are you there?
Vishnu? Is he there? I can't see whether he's still there.
Magnus, are you there? Magnus? He was waiting for a long time, but he wanted to go last. So let me see.
Vishnu, do you see him in the video?
No, I'm searching, sir. I don't see him, sir.
Vikram, can you ring up and find out whether he is there?
He's not there, sir. I have not seen him here at all. So.
No, he was there in the beginning.
Is it? Actually, maybe for a short time, maybe. So, but as such, I didn't see him. So.
Yeah, if I've missed out anybody, please unmute yourself and speak. If anyone, any of the youngsters have any questions directed to anyone in particular or in general, please go ahead, because we'll wrap up in another five minutes or so.
Actually, Dr. GVSN is there. We have not spoken to him for a long time.
Oh,
he's
Dr.
yeah. So he's contemporary of Srinath. So I can see his name at least there. So I don't know
Prasad,
that
Prasad.
yeah, GVSN Prasad. Yeah.
Dr. Prasad, would you like to unmute yourself?
Prasad.
GVSN, are you there?
Yeah, Dr. Shastri is another senior surgeon who's been with us right from the beginning.
Can you hear me?
Yes.
Good evening, everybody, sir.
Long time.
It's a long time.
You're not seeing you for a long time.
I was just listening to all the greats, including Srinath, my batchmate, Sir Kate sir, Dr. Ananthakrishnan, and Radhakrishnan sir. So
On your video, man, Prasad.
Yeah, I'm just get back into position. So it was nice hearing.
Only person we'll excuse from not showing his face today is Donald Trump.
So give me 1 minute.
You have to come
me 1
on
minute, sir.
video.
I will again come back on the line. Just give me 1 minute.
Okay.
You can carry on. I'll just join you in 1 minute.
Okay.
Okay.
It looks like we missed Dr. Shastri. He was there right from the beginning.
Magnus, come back.
No clue. I don't see him, sir.
Okay.
I don't see him.
That I think is, we have finished the list.
Yes, sir. Perhaps.
Dr. Jagdish is also there, so if you'd like to say something.
Oh, Jag.
He's also there.
I can't see anybody. That's why I don't know who's there.
Dr. Jagdish, actually, he's visible here.
If you would like to, yeah, Dr. Prasad is back, I think. I don't know.
Yes, sir. I'll just join in 1 minute, please.
Prasad always required a little larger screen.
Longer time also.
Yeah, longer time, of course.
He always have some papers in his hand in the morning. Always.
He's a man who could
now, sir?
Look busy without being busy. Oh, Prasad.
Very nice to see you, sir.
Good to see you.
All my teachers I can see there.
Yeah.
So nice of you, sir. Only thing I just had a doubt, sir. What about this cost of this liver transplant so much? Why not go for tissue engineering, 3D printing, and stem cell research? What are the prospects in the future?
I don't know the spelling of any of those, so I'll leave it to the experts to answer. Come, Srinath or anybody else. Srinath, you're the only one who could answer Prasad, man.
I know. Actually, the only thing Prasad wanted to do during my residency was he wanted to do the first appendix, the first hernia, the first DU perf.
That was the
So he
interest
was
show
first.
because.
Yeah. Good question, GV Prasad. The main problem with bioprinting, et cetera, is that, as you know, the liver hepatocytes secrete bile. So you have to have a channel to drain the bile. So all the tissue engineering that is happening, the main problem is to obtain bile drainage. So at Minneapolis, there are two groups that are working on this. One is a group that is actually a drug corporation sponsored one. What they're doing is that they're taking livers and essentially digesting all the hepatocytes off of a pig liver so that there's a scaffold, and then trying to put stem cells in there.
Implant.
But it's that's very far away. The more important thing which we are working at the university is Zeno Transplantation. So one of my colleagues actually has got a grant. So we are looking at CRISPR technology to do Gallic pigs and trying to transplant them into monkeys. So we have a model where we take the kidney and we have been putting it into monkeys. But, kidney is really simple in the sense that the kidney is a filter, it filters the blood. Of course, it makes a little bit of proteins, etc. The problem with the liver is that some of the pig proteins are not compatible with human things. So it's really in a very, very, very early stage. Yeah.
Thanks, Srinath.
Yeah.
So, Ravindra could not join us today, but he had, said a few things. One of which he was saying that hopefully we'll have a normothermic perfusion so that you people won't have to do transplants in the middle of the night. So maybe more people will take up liver transplant and not so many would leave.
That is a good idea. It is a good idea. Hopefully it will become popular. Again, cost is a major concern. At the moment, each normothermic perfusion costs anywhere between $20,000 to $50,000. So you're adding the cost. So that's again the problem. Yeah.
So would you like to wind up, sir? Ananthakrishnan, sir?
So Vidya, can I?
Yeah, please.
Sorry, Vidya, can I just talk one? Dr. Ananthakrishnan, I'm hoping that you're going to be proud of me. I just got inducted into the American Surgical Association. As you know, the American Surgical Association is the oldest surgical association in the US. They have a cap of 460 members, and they only induct people that have made primary contributions to surgery. So actually, day before yesterday, I got a letter from them that I got inducted. So I am so thankful to all of you, and I think it's, a little kid from Gormito making into the American Surgical Association. I think
congratulations.
The credit goes. Yeah,
Congratulations.
Credit goes to.
Srinath. Well done.
That's really great news, Srinath. And I'm sure this is just the first of many more. And certainly we are proud of you. We have been proud of you even formally before you got this. And now we'll be even more proud. And let's see a few more down the road.
Thank you.
So Magnus just rejoined. We'll just give him a minute. Magnus, we are going to close. So if you want to say something, please unmute yourself.
Magnus is a man with a lot of muscles. You don't give him a minute. You give him what he wants. Okay.
Thank you, sir. Thank you for the opportunity. But I'm one of the guys who was presently not in transplant, trained in transplant, but I'm back to GA surgery. So I can answer the last question that you asked, why people who are trained in liver surgery, liver transplant, have not continued in transplant. So I followed Funny. I was with him in Asian Institute of Gastroenterology, and along with him got into liver transplant. And for transplant training, I went to Dr. Subhash Gupta in Delhi CLBS. And after that, I I started my own program with Dr. Olit Selvan, who is also a JIPMerite, and another colleague of mine, Ravi Chand. And we had a pretty decent run in liver transplants, but at one point of time, we were running out of cases. We were not able to get enough number of cases to operate. We might be doing 1 or 2 transplants a month, and that was really frustrating after having worked in high volume transplant centers. And all of us had to go back and do our own thing. I came back to JA surgery. Oli has gone back to UK, probably to a non-transplant liver hepatology program. And Ravichand is working on HPB oncology plus some transplants by the side. I'm always on the lookout to join back liver transplants. I'm with Dr. Rajnikant and Dr. Srinivas Reddy in the same hospital. I'm in the GI surgery department there with liver transplant. Hopefully, I get back to liver transplants. But that's my story for now.
Thanks, Magnus. Thanks for staying on so long.
Thank you, sir.
Would you like to wind up, sir?
No, I think we are not given Patta any chance to say anything. Let him say something before I say good night.
Okay, sir.
And it's so
Sir was
hard
not
to.
there when you started, when we started Patta. So even if you have to repeat, just go ahead.
See, it's so heartwarming listening to everyone talk so nice about JIPMER surgical training, and especially training under Dr. Ananthakrishnan. And I'm one of the last people to add that he is the inspiration for almost all of us to take up surgery as a career. I can't repeat what all they have said because, it sounds superfluous. But then, sir, you've been the inspiration for all of us. And actually, JIPMER surgery is one of the strongest departments.
Yeah, but Patta, you're not telling the other half of the sentence. You wanted to become a surgeon and you made sure that you don't do it in JIPMER.
Like Srinivas Reddy, sir, the inspiration is there always there. And it's so nice of you to have threaded the whole story today. And it's really, really heartwarming to listen to so many seniors, and you've done really, really well. And I think Srinath's thing is icing on the cake. Definitely icing on the cake. I remember Srinath as a very puny little, very, very sort of like a little lamb when he came to the All India Institute. Now is such a big shape.
What was he doing in JIPMER? Was he busy with other activities and not attending classes? How come I don't remember him?
So it's wonderful, sir. It's a great program, and thank you so much.
Vidya?
Hi, Ravi.
Oh, hello, Ravi.
Yeah. I, as a complete non-surgeon, non-anesthetic anesthesiologist, I have to say that it was two things. When Vidya asked me to help her contacting people, it was really a joy to find a lot of these junior JIPMerites that I did not know of. So first of all, Srinath, congratulations. And you really make all of us proud. So that was number one. Number two, I did try really hard to get Govardhan. I left several messages with his service. And I just want to say that he's still billed as a liver transplant surgeon. So maybe he's still doing it. Maybe he's still not quit completely. So I don't know that. Just wanted to add that. And secondly, this whole program today has been so wonderful. So once again, thank you to the triumvirate, Vidya, RK, and Professor AK. Thank you so much.
Thank you all. Good night, everyone. And it's been really wonderful. I can't say in words what it means to me, and I won't be able to sleep tonight. 3 days I have not slept because of Srinath, and today 4th night because of all of you. And I hope we can do it again sometime. And really wonderful to learn about your achievements, your journey, and how you have reached where you are. And you're contributing so much in a field which is so much in demand all over the world. And it makes me proud to know that somewhere we have played a small part in your development. Thank you for giving us the chance to be part of your journey, and really thank you again for coming today for the meeting.
Thank you, everyone. And it was Patta's idea about trying to get JIPMER linked liver transplant surgeons together. And all I had to do is just put the idea to Professor AK, and then he made it, this whole program, the structure, everything, planning, execution, everything has been done by sir. And thank you so much, sir. And thank you everyone for joining in, and sorry if we kept you up too late.
Thanks, Vidya. Great job. Thank you, everyone, and good night and good morning, or wherever you are.
Thank you very much.
So we will meet again next Thursday at be back at 8 o'clock with another episode of Marvelous Medicine. Thank you, everyone.
Thanks, Vidya. Thanks, Patta, and thanks, everyone.